Welcome back to Pharma-info with Shivashish. Today, the topic which we are going to focus on is 3D-QSAR. In my past videos, there was a discussion on this 2D-QSAR and all. So we discussed a lot about the different variables of descriptors which are used in 2D-QSAR, right? And there we found that ultimately we have to deal with the equation which is derived from the 2D-QSAR study and all. And with that, the equation has to be handed over to a chemist, and now the onus goes to the chemist. The chemist will try to figure out, try to find out every possible clues and all, through which he or she can develop a novel compound, right? Because basically what for we are running this QSAR, irrespective of the dimension of QSAR, what is the purpose behind running QSAR, behind this carrying out this QSAR study and all. So now the thing is that just the primary goal is to come up with a model. Through that model, at least we are in a position to design a novel compound, design a compound. Right? Okay. Now let us deal with 3D QSAR. So we talked about this 2D QSAR. There we found that basically it is the certain properties of substituents which are found to be the part and parcel of a skeleton, right? A molecular skeleton, okay? And they're just correlating, considering the fact that all these properties, okay, are involved, okay, in the process of evolution of the biological response, right? So 2D QSAR basically it revolves around the assumption that it is out of those properties biological response is fluctuating, right? Why I'm telling fluctuating? Because behind each and every modification we are after what? We are after biological response. Is it increasing or decreasing? That means a fluctuation now, right? But why this 3D QSAR came into existence? Okay, what was wrong? That means something went wrong in 2D QSAR. It's not that always, okay, the predecessor was found to be wrong in his approach, in his or her approach, right? Okay, it can happen that, okay, in order to just make it more illustrative and all, we'll just go for a new technique, right? Or something like that. It's not that 2D QSAR बेकार है, उनमें से हमको कुछ नहीं मिलना है. It's not like that, right? Okay, 2D QSAR is still now it's a traditional QSAR, right? As it's a traditional QSAR, that means, and moreover it relies on so many descriptors, so many properties and all. Okay, so but the problem is that the complicated mathematical equation, right? That is the problem. Okay, the problem was there. Few more problems are there. Okay, and that is why the thought of developing something which at least they can get some better idea. They can generate some better compound, right? Okay. Now let us move to that particular thing, 3D QSAR. So for that, in order to deal with the 3D QSAR, first let us see that what was wrong in 2D QSAR, right? That means something was wrong, right? Something was wrong. Something was found to be poor. Right? Something was not found to be that much accurate, right? Okay, this was the problem with this 2D QSAR. 2D QSAR, first and foremost, the compounds which are considered, which are being taken for the study, they should have a similar structure and all. That means structural similarity should be there, right? The second thing is that the data generation, right? The data generation mostly relies on the rate constant, right? And we know that it is the rate of a reaction that can be influenced by multiple factors or multiple properties, and therefore all those data are not found to be that much authentic, or we can say that the reliability of those descriptors is open to doubt. Right? Okay. The second, the few more are there, like your suppose ki in case of in basically in 2D QSAR, it will not directly suggest you to synthesize that specific compound, right? It's not like that, right? That means straight away you cannot get the idea, yes, this is the compound which I have to synthesize and all, right? This is another disadvantage, what we can say. And moreover, the complicated mathematical equation, right? And we can say that with this mathematical equation, it's very hard for a chemist, okay, to come up with a novel idea or novel design and all, right? Yes, mostly we are relying on, because 3D QSAR came in, it came into the market, if I am not wrong, that is in mid-90s, right? But before that, all the things were of 2D QSAR or conventional QSAR. That means it was so robust, okay, so robust, and that time what we can say, the intuition was very immaculate for those chemists and all that time, those days. I'm talking about 80s, 70s, like that. Okay, those days. Okay, chalo. Now let us see that. Okay, this was the problem, right? So right now we dealt with what the few pros and cons of 2D QSAR, right? Okay. So those things were found to be the shortcomings in 2D QSAR. So that is why they thought that, okay, let us just make it, make it concise. Okay, make it concise so that chemist can feel, or chemist should feel, okay, or can feel much comfort in dealing with that particular thing, particular output, and immediately he or she can come up with a novel design or a novel compound, right? Okay. So for that, they thought that basically, in case of 2D QSAR, so many descriptors were involved, right? But in case of 3D QSAR, before initiating the process, they thought that, okay, basically the biological response depends on the molecular shape and size and electronic features, right? So these two or three factors, or three parameters, which are found to be solely responsible in controlling, in operating the biological response, right? So what I told, that is, it revolves around the idea that it is the molecular size, molecular shape, as well as the electronic distribution, right? These things are found to be crucial, right, in determining the biological response, in evolving the biological response, right? So thinking that the molecular shape, size, or the bulkiness, as well as the electronic distribution, these properties are found to be important. They just tried to correlate these properties to biological activity. Okay? They just try to correlate, right? So what they did basically, they just correlating biological response to the change in, any change in the biological response. Because what we are after, we are after monitoring the event of biological response. With this substituent, is it deviating from the previous one or not, like that, right? So if that is the case, the modification, whether it yields a better product or it yields a poor product, that we are after, right? So that is in that case. So they thought that any deviation in the biological response, they just try to correlate to the different fields, that is static field, electrostatic field. Now, one new terminology came into existence, that is field. What is that field all about? So what is field? As I told, that static field. Static property means the size, the shape, the bulkiness of the compound, right? Just now we told, no, that the biological response is solely depends on what? The biological response depend on the molecular shape, the size, the bulkiness, as well as the electronic distribution, right? So these properties are found to be the dominating force, the driving force for the biological response, okay, to grow in a proper manner, right? Okay. So as I told, that static field. So what is that field all about? Field is nothing but, in a simple sense, field is nothing but the influence that a property has on space surrounding the molecule. What I told? Field is nothing but, static field means the influence that a property has. So static property, the influence out of this static property, the influence that a property has on space, suppose this is found to be the atom, right, or consider this as a molecule on space surrounding the molecule. That means what we can, that means the compound can experience what? The static property here. It is out of what? It is out of static property. So that means the influence that a property has. That means this may get influenced by the static property. That means the influence that a property has on where? On space surrounding the molecule. Here it is atom. You have to assume it as a molecule, right? So field is nothing but that. So I think that I'm clear, right? Okay. So with this field, so here the static field and electrostatic field, these two fields. So it's an event of calculating what? Static as well as electrostatic fields, right? These fields are calculated. These fields are correlated to the change in biological activity. So basically the principle of this 3D QSAR is any change in the biological response correlates to the change in steric as well as electrostatic field, because these two are the properties, these two are the parameters, these two are the vital things which are controlling the process of biological response. So that is why these two, any change in the biological response, so they are just correlating this to this. So any change in the biological response directly indicates that there should be a change in the steric as well as the electrostatic field. And we know that what exactly field is. So field can be defined as the influence that a property has on space surrounding the molecule. That is nothing but field, right? Sure. So now let us move to that what exactly they are doing in 3D-QSAR, right? Okay. So as I said that the basic the principle of 3D-QSAR, right? What exactly they are doing? Okay, what exactly they are doing? They just try to monitor, try to correlate what the biological response, what exactly they are doing, and so here also you have to deal with so many compounds, like we took in case of 2D-QSAR, right? In case of 3D-QSAR, you have to deal with, first and foremost, you have to fetch. You have to fetch what? You have to fetch a bunch of compounds, right? A bunch of synthesized compounds, a bunch of chemically characterized compounds, a bunch of biologically evaluated compounds. And we follow the same thing here also, right? In order to initiate the process, in order to start up the venture, you have to follow what the process is found to be more or less similar, the one which we found in case of 2D-QSAR. That means a pool of compounds, a pool of biologically evaluated compounds, a pool of biologically evaluated compounds has to be considered, right? Or need to be considered, right? Prior initiating the process and all, right? And once you collect, once you have collected the compounds, right? Collected the compounds, it has to be, that means you have developed a database, right? The database includes what? Synthesized, chemically characterized, biologically evaluated compound. That means you have with you what? The biological data for each and every compound, because we are least concerned about this chemical data, chemical data or chemical or analytical data and all, right? Because analytical data has nothing to do with this QSAR study. We are bothered about the structure as well as its biological response, right? So that means the biological data should be there with you. So with this, you have to initiate the process, right? Okay. Now the thing is that, as I said earlier, that in case of 2D-QSAR, what are the compounds that you are going to take for the study and all, they should have a similar structure, right? And that constraint is not there in case of 3D-QSAR. In case of 3D-QSAR, what they are suggesting us that as long as the compounds share a common pharmacophore, as long as the compound, that means the pool of compounds, right? As long as the pool of compounds share what? The common pharmacophore. That means as long as they are interacting with their active site or with their corresponding target in a similar manner, and the manner is nothing but non-covalent in nature, because they are assuming that whatever interaction that is likely to be taking place between drug and receptor, they should be non-covalent in nature, right? So as long as the compounds they are sharing a common pharmacophore, that means they are interacting with their corresponding target in a similar manner, you can take them, you can incorporate or include them in the study. Followed? So this is found to be the basic requirement of what? This basic requirement which has to be what? Which has to be put while considering the compounds to run the show, that is the 3D-QSAR, right? Okay. Now, so we are done with few things like your, in case of 3D-QSAR, what exactly they are doing, right? They are basically correlating the biological response or the biological activity to, that means any change in the, as molecular shape, size and electronic properties, okay, they are responsible for the biological response. So any change in the biological response can be correlated to what? The steric as well as the electrostatic field, okay, field. And moreover, what are the compounds that you are going to take, okay, they should interact with the target in a similar manner. That means they should have a similar pharmacophore with them. Hope we know that what exactly pharmacophore stands for. That means the functional groups which are responsible for the pharmacological activity, right? Okay, I am planning to come up with a video considering the topic of pharmacophore modeling and all, okay, in future definitely. So in due course, I'll launch that one also, no problem. In that, I'll discuss in detail and all what exactly Pharma-info stands for. But hope you know that Pharma-info is nothing but the groups which are responsible for the biological response or the pharmacological activity, right? Chalo. So now the thing is that, as I said, that what are the compounds that you are going to select for the study, right? They should have the common pharmacophore in them. That means they should interact with the target in a similar manner. And the manner is found to be exclusively of non-covalent in nature, right? Chalo. Now let's move to what exactly they are doing in 3D-QSAR, right? So in 3D-QSAR, basically in 3D-QSAR, as I said that long back in the year of 1994, right, a company called Tripos, okay, they launched the software, right? So they developed a software, right? In that software, they just incorporate a method, right? The method with which a 3D-QSAR can be successfully run, right? Okay. Now, Tripos is the company from which we got the software, and through that software we got the method, okay, which is applied or which is employed in 3D-QSAR study. That and the method which got the ascendancy is called COMFA. COMFA is the method which got the ascendancy. That means from COMFA, it was n number of papers during that period from 94 to 2007 or 10, right? Maximum 3D-QSAR paper or articles, right, or manuscripts, right? You can find this particular method was used, right? Okay. Now, so COMFA, what is COMFA, right? There are several other methods are there, like your COMSIA, okay, COMSIA, then HINT, then COMASA, right? Just all these things are there. But at present, we are going to deal with COMFA, right? What exactly they are doing in COMFA, because it is the basic thing, right? The basic thing. So COMFA is nothing but, as I said, field. So here also field is coming. Okay, F for field. So what? CO for comparative. It's not company, comparative. So CO for comparative. So it is comparative. Comparative. M for molecular, right? Because you are correlating the molecular properties to biological activity, and the molecular properties are nothing but here two properties, two essential properties, which are they are nothing but steric properties as well as the electrostatic properties, right? Chalo. So molecular, comparative, molecular. What next? F for, as I told, F for field, right? Field, and A for you are analyzing, right? Okay, you are analyzing the processing, right? So it's basically comparative molecular field analysis, COMFA. So if we just try to deal with this acronym, it appears in this form, comparative molecular field analysis. So here, what are the fields that we are going to analyze? The fields are nothing but steric as well as electrostatic, right? Okay. In case of COMSIA, if we just try to expand it, here also CO means straightway comparative, M for molecular, right? S for I for. So this is found to be the change which is there, which you can find in case of COMSIA, which is not there in case of COMFA, right? SI for similarity indices. Similarity indices analysis, right? So here also they are focusing on, they are calculating what? Steric as well as electrostatic field. But in addition to this, hydrogen bonding, hydrophobicity, these two properties, or these two properties, they are also considering these two properties. They just have included additionally these two properties. What are those? Hydrogen bonding, at the same time hydrophobicity, right? Okay, one is found to be electronic property, hydrogen bonding, dipole-dipole interaction, and hydrophobicity, right? Hydrophobicity. Now, so this is about COMSIA, right? Okay. Let's see that what exactly they are doing, the basic principle of COMFA and all, right? How they are doing, how they are executing the process and all, right? Okay. Now, the thing is that first let us move to this COMFA. What exactly they are doing? Comparative molecular field analysis. So in case of COMFA and all, first, what exactly they are doing in case of COMFA? They are just calculating what? The steric field as well as electrostatic field, right? And here they are using what? A grid. And each grid, it is having several thousands, lattice points and all, right? Grids are found to be something like this. Roughly, it is something like this, right? Roughly, it is something like this, right? We have n number of things are there, right? N number of things are there. So several points are there, several points are there. Right? Several points are there. So this is found to be the basic form of this grid, right? Okay. Grid is nothing but what we can say, it's a grid box through which we can determine, we can measure what the molecular properties. And grid, not only it is used in QSA study, it is also used in molecular docking study. In case of molecular docking study also they are using grid. In case of 3D-QSAR they are using grid, and they are considering this grid as a pseudo receptor, right? Pseudo receptor, right? And here plenty of lattice points are there. Lattice points are there, right? And with the help of a probe and the compound under training set, right, we are determining what? We are determining the static as well as electrostatic field of each and every compound considered for the study. Okay? Now, the thing is that, so in case of 3D-QSAR, grid is for measuring the properties. The properties are static property as well as electrostatic property. But in case of molecular docking study, what kind of property they are just, with this grid, what kind of things they are just trying to extract? They are extracting what? The molecular interaction. The interaction between placing the grid within the active site, they just try to get an idea that how this or what are the type of interactions that are likely to be possible within the active site between the drug, between the ligand and the receptor. That means the residues, how they are interacting with the functional groups of the ligand, right? So it is the grid. By placing the grid in each and every corner of the active site, they just try to get an idea or develop an understanding of what kind of drug receptor interaction is possible, okay, with this particular target and ligand, right? Okay, this is about molecular docking study and all, right? So let us just back to our business, that is your grid for 3D-QSAR, not for molecular docking here. And what for it is there? It just grids are used for what? Grids are used to measure the properties. Here, in case of Compa, we are focusing on what? We are focusing on static property as well as electrostatic property, right? So, now, so this is the basic form of grid and all. So what they are doing in this Compa method and all? First, they are just defining what? Two steps. First, you have to define what? You have to define static and electrostatic fields. And next is you have to relate the fields to the biological activity. That means relate fields to biological, or rather use the fields to determine the biological activity. You are relating the fields to biological activity. As I said at the initial stage, that any change in the biological response is straightway given to the change of what? Static as well as electrostatic field. So firstly they are doing what? They are just defining the static and electrostatic field. The second thing they are doing is they are just try to get the biological activity with the help of these fields and all, or they just try to relate the fields to biological activity, right? Okay. So let us just deal with them one by one. Now, so in order to start the process, as I told you, that a pool of compounds, a bunch of compounds is to be taken, right? Suppose we have taken 100 compounds, right? Suppose we have taken 100 compounds, right? And the 100 compounds can be split into training set, training set and test set, right? Under training set, assume that you have put 80 compounds, and in the test set, the rest of the compounds you have incorporated, right? Okay, we'll come to it. This is at the end of the show, we'll come up with this, right? We have to deal with this test set. Now, first, let us deal with this test set, right? Now, in order to make it more concise, more informative and all, so what are the compounds they are taking, or they are considering, or they have incorporated within the test training set, right? Within the training set, okay, they just try to downsize them. Why downsizing is important? Just to reduce the burden, right? Just to reduce the burden of dealing with so many variables, right? Okay, so that means in the test set, just now we have found that we have incorporated 80 compounds. So we have considered 80 compounds for this training set, right? But after incorporating them, the next step is what? Trim it down, right? You have to trim it. You have to trim it, or we can say you need to downsize it. Downsize it means and during the process of downsizing, it's nothing but you have to make it from 80 to 70 or 60 or 50, something like this, right? So that means you have to screen out few unimportant compounds which are not found to be biologically relevant, right? The compounds which are not found to be biologically relevant, they need to be determined, okay, prior starting the process, right? So that means with this 80 compounds, you have to start the process. Now, before starting the process, from this 80 compounds, you have to screen few them out. You have to screen few compounds out of that particular show. Why? Because considering the fact that out of this 80, few compounds are there, they are not found to be biologically significant. As I told that, it revolves around the assumption that it is the size, shape and electronic property they are found to be, they are responsible for controlling the biological activity and all, right? As I told at the initial stage and all, right? It is the molecular size, shape and the electronic distribution, right? It is controlling, or it is having a control over the biological activity, right? So likewise, as I told, and moreover, the thing is that as long as they are interacting, they are sharing a common pharmacophore, interacting with the receptor in a similar manner, okay? So that means the moment you notice, the moment you observe the dissimilarity, that means the compounds which are not likely to produce the same kind of effect, or which are not likely to interact with the receptor in a same manner, in a similar manner as that of the rest, right? In that case, and the moment you observe this particular discrepancy, what we can say, so those compounds which have not turned up or which did not turn up, right, they are being thrown out from that particular set, right? So that means when the operation has already been executed, now I have with me around 70 compounds. So though at the initial stage I have with me 80 compounds, but considering the fact that out of these 80 compounds, few of them are there, they are not interacting with the rest, they are found to be biologically irrelevant, biologically not significant. In that case, I have just screened them out from the show and just make the training set bit thin or slim, right? So here I did what? Slim and trim operation, right? Just to reduce the burden of what? Burden of dealing with so many variables and all, right? I'll come to it, the variables and all, lateral part and all. So this is about the training set, this is about the test set. Now what next? The next is, for each and every compound, you have to do the conformational analysis, right? For each and every compound taken for the test or taken for the training set and all, for each and every compound. Now we have with us what? 70 compounds, right? So starting from the first to the 70, conformational study has to be carried out. Conformational study. Conformational analysis. For what? Because whatever interaction that is existing in the earth between drug and receptor, right? What we are expecting, the interaction is found to be more stable or most stable. That means most stable means it is that orientation which can give us what? Which can give us the biological response according to our expectation. That means we are satisfied with the biological response. And how we got the satisfaction? Out of what? Out of the biological response. Now, why it emerged? Out of significant interaction. That means once interaction has been made, that means you have to deal with a particular pose, particular orientation. In that orientation only, the moment the drug acquires this orientation, it is being readily caught by what? Caught by the active site residues, right? And finally, we have got a significant interaction, right? So that is why I am telling, that means, and a particular drug can appear in several forms, several orientations. That means we need to seek after the orientation which is found to be promising. And the promising orientation should not be energetically unstable. That means it should not be highly energetic. It has to liberate enough amount of energy to get the stability. That means moksha, something like this. You are inert to the stimuli, external stimuli, right? So that means conformational analysis done. Okay. So conformation analysis done. Now, so this is about we have to deal with conformational analysis, right? And what for conformation analysis has to be done? To just incorporate the compound in its stable state. So with that, we are done with today's discussion, right? Okay. In my next video, I'll come with the rest part of this 3D-QSAR. Thank you for your patience hearing. Thank you so very much.